Thank you very much for being back with us. And it is 11 o'clock. We will break for lunch at 12 o'clock and have a 30-minute lunch and then be back at 12:30, 12:35. And then we'll be here all afternoon as long as it takes to get through it. I figured it out that we have 10. We've gone through 10 of them. We've got about 50 to go. And that's real. It's about 50 to go. And it took us from 8 o'clock till 11 o'clock. So it's however long it takes us. Just wanted the commissioners to know that going through the process. Okay. That's if you want to talk a lot, ask a lot of questions, or be quiet. It's up to you. It's up to you, gentlemen. Okay, next item is mapping. Mr. Smith. Mr. Mayor, you have?
Yes. Mr. David Mann had asked, he's got to be in a meeting. What time, David?
1 o'clock.
At 1 o'clock to 4. He was wondering if we could change his rotation here and get him in sooner.
Sure. Would be the next on the list.
Okay, thank you.
Questions about mapping? David was saying to see if, and he had mentioned, I know, 2 of the steps that were not in the recommendation, but he had requested about those. Those are 2 single or 1-step increases.
1 step
each. And I think it was $1,700 or $1,800. He was asking about that. Were there any other questions about mapping from the board?
Any questions, commissioners, on mapping?
Oh, yes, Mr. Chairman.
Yes, Mr. Daugherty.
Mr. Ward, going to 190,
Yes, sir.
professional services. Again, budgeting $20,000. We've had $7,800 as of February, and to date, Ms. Hope,
7,300 is what I got.
you have $7,300
Somebody got
to
rid
date.
of it.
And we would like to reduce that line item.
Okay. And also, we're doing some document scanning, which is we're scanning our deeds as those come in, and the deed sheets we utilize, make notes on when we're processing. And I don't know if y'all have gotten this yet, Pam, but we've just gotten another bill from those folks, and I don't know that that's in what you've got yet.
Not if it was issued for payment.
It was probably paid Friday, probably. I'd have to check that.
That amount.
I apologize, I don't have that amount with me.
Approximately.
I'd have to check. I'm thinking sessions we've done, it's gonna probably be $3,000-4,000 somewhere in there.
Well, I'd recommend we reduce that from $20,000 to $15,000, and that should cover well in excess of where you're at now.
And of course, on this scanning, we've actually backed up and gotten back years we've had hard copy on. We've had them scanned so we can utilize them that way. And then moving forward, we're probably going to be doing this, get a couple of years at the time.
Sure.
We're at the point we've almost caught up to where we are. We've still got a ways to go, and then we'll be moving forward.
So
with it.
would you feel comfortable that we cut that to 15 versus 20, where you're at basically 10 now?
Yeah.
Be going to 15.
We can go with that, and then if I check my figures and a red flag goes up, I'll let Mr. Smith know.
And then on office supplies, again, you're at, well, we'll leave that alone. 261, non-capital, we spent 0. You got $1,000 budgeted.
We put that in there if we need a new chair, stool, whatever it might be. Sometimes things pop up like that. We have had to buy some of those along the way, and that's why we put that in there, just to protect for that, or to have that available for that.
And why wouldn't there be any history on this going
Mr.
back?
Daugherty?
We're not.
Can you pull your microphone towards you, please? And up. Thank you.
Okay. Why wouldn't there be any history on any of these items, in fact, actual and so forth?
As far as those type things, we've not had to spend any money on any one of them right now, but just like in the main office, over the years.
It was with the planning
last 2 or 3
department. We
years.
moved these from the planning, I'm sorry.
Oh, okay.
Just go
We
ahead.
moved it.
You moved
And
it
so you
over
lost
from
your
planning.
history.
Okay.
So we moved it out of planning back into tax. And we
Okay.
do that,
All right. So you feel comfortable on those figures? Do you think that we may reduce those estimates any, or?
Well, you know, the non-capital, like I say, that's, if something happens, we have to replace something, that's what that's for. You know, if you want to cut it to 1,000 or 500, you can. Just depends on if something happens, and if it does when, we'd have to see what the cost is, and hopefully we'd have enough to cover it.
And then travel, meals and lodging, you got $2,000 there?
Yes, sir.
You think that can be reduced because $20 as of February?
Okay, we just had one of our folks go to a seminar last week one day, and, let's see, but didn't we spend more than that? Because I was thinking we sent him to school, I'm not sure.
But you've also got on the plans to do certifications too on the mapping software, but there are actual certifications that they'll be doing. And that's part of what we've talked about. They were doing that, I think, leading up to it when they were over in planning GIS, were to get these folks certified. So I would just tell them the training piece here, if they get it wrong, the whole system's wrong. And so what I'm telling you is this is a first year. We're not talking, I know every dollar
Understand.
counts. I'd leave it. It's just, this is really going to be close this year in this department.
Okay, so we'll just cut the 5,000 out of 190.
That would, I would leave the others because it's going to be close in this department, I've got a feeling.
Thank you, Mr. Chairman.
Any other questions before we move on? Thank you, Mr. Ward.
Yes, sir.
At this time, we'll ask Health to come up, please. Mr. Madden. Under.
GIS, and then we'll just, his should be short.
Okay.
Okay.
Or is that, okay, Chief?
We wanted you to sit here through health.
Yeah, thank you. Appreciate that.
Mr. Chairman.
Mr. Daugherty.
Item 352. Just kind of bangs out at me there, $60,000, whereas it was 47,000, 37,000, 5,900 actual to date. What is to date? I'm sorry, as of February.
Yes.
5,900,
No, I'm sorry, that's 352. And to date, how much have we spent?
5,900.
5,900.
You got encumbered 27,150, which will take it to about 33,500.
33,500, because you got some encumbered.
And some more, those are usually paid at the end of the fiscal year. We've
You've even got
another
more?
12,000 that are being sent to finance right now. They're usually paid at the end of the fiscal year. Those are all maintenance contracts.
So it's going to be around 46,000? Are there any additional?
Well, there, also in there was a Code Red, which we don't submit that bill, but we were told to fund for that. It's submitted by another department. I guess it's paid for out of this line item.
And
That's
how much
always
is
been
that?
left in there.
How much is that Code Red?
I think it was $25,000 at one time.
You talking about on the,
Code Red, reverse 911. Yeah. It comes out of this line.
Let's ask
too.
you to come, hold on a second. Okay. The 911,
Reverse 911 Code Red warning system.
yes, I'm familiar
Yeah.
with that, but it was asked
It's
to
paid,
be,
it's budgeted and paid for out of this line item.
why is that? Just
Been there for-
It's been there ever since.
yeah, because it's part of, Joe, I mean, we started out, as part of mapping, because it looked at, I guess, the mapping piece of, that's the only thing I can come up
It
with.
uses GIS data, in their
Sure.
Yeah.
system, but
And that's where we plugged it in years ago when we
It's just a
started it, and we
spot
just
to pay
left
it
it
from.
consistently there. It could be there, it could be in OES, it's still all county money.
Sure, I
Yeah.
understand.
But it is Code Red,
And it's 25,000 a year?
yes.
it's a subscription, yeah.
Well, I cannot, if it's tied, I know it's tied to GIS, and I know how that 911 works. But if it's tied to 911, it's just a question. If it's tied to 911, then if it's an expense of 25,000, And I know it's all county money, Mr. Smith. I'm just trying to get it specific to its subject
Sure.
matter. That's
We've
all.
talked about moving it, but it's just one of those, it's been there. And if we move it, obviously, it looks like this one drops, but yet you add it somewhere else. So just so if we do move it, you're aware that we would move it. And it could go to the communication side, or but we just want you to be aware of when we do those, that we are making those kind of moves, so.
Sure.
Yeah.
It was just a comment.
Mhm.
Okay. When he said 911, it just, okay.
Then item 520, capital, oh, I'm sorry.
So what are we gonna do with
Mr. Daugherty, Mr. Mayo,
No, I was just.
Well,
Mr. Daugherty, and then Mr. Mayo.
If you add all that up, actually, if you add all what you just said, that's going to be $71,000. You ain't got enough for your budget.
I believe it is. I mean, it's what we've always budgeted the last several years. I could go back and re-verify that exactly for you.
So that's what you budgeted
Yes,
for the last several years, and it came close to that?
yes.
Well,
You're talking about still on 352?
352.
I'm sorry, going back to 352?
Yeah, you're bumping that 60,000. I
It's,
mean,
it's right there at it, yeah.
Well, his history is not showing that, though. You're looking at 47, then 37, and then this year,
Yeah, the only thing that we don't get the bill for the
We just charge it
Code
to that
Red.
account.
Yeah, it gets charged. I don't see that, but
yeah.
everything else comes through me for the GIS stuff, which is the
We
you
just
feel
hit that
comfortable
line.
on the
311
60,000?
GIS, Map Nimbus, to Go
Particularly with
Maps.
Code Red and that area.
Okay.
All right, let's move on then.
Mr. Mayo.
No, I was just communicating with Mr. Daugherty.
Say, move on. 520, capital outlay on computers. I mean, we got to find some money to cut here somewhere, so now we're down to this one.
Okay.
What is the 45 for, and can we in fact reduce that line item?
Well, the county operates on a mapping system that is about 3 years behind on the software. We do that mostly in part because of the desktop computers are not capable of handling the newer software. It puts more of a load on those computers. If you don't fund getting new desktop computers for the people that do the editing and use that software, then there's no reason to upgrade to 10.1 because I don't think it'll be functional for those machines. So obviously that's hinged on upgrading those machines, and that comes through the IT budget. So you got a migration to the 10.1 mapping software. That would be, it's a complex scenario. It's integrated into many business practices that we have here, integrated in with the tax department. It's integrated into the city of Goldsboro because for 911 records, the city of Goldsboro maintains their own addressing records, and we are connected to them. So it's a complex process, and we have to hire a outside vendor to come assist with that process.
I understand, but $35,000, do we
45.
need $35,000 worth of new desktop?
Those are firm numbers, yes.
Those are firm numbers.
Yes, those were quotes, yes.
They had the quotes. And
How many
actually cut it
computers are you
10,000.
upgrading? I mean, how many new computers are you purchasing?
What was the number? It was about 30
Yeah. it's-
30 machines.
We got, IT has 30,000 budgeted just for upgrade, the new computer systems.
And who are you providing these to? Because they're not in your department.
They are located, GIS people are located within most of the departments: environmental health, planning, tax mapping, Board of Elections, soil conservation.
So you're upgrading all those workstations?
The ones that have data editing that deal directly with GIS data.
Those ones use super users or whatever you
Yes,
call
power
them. Super
users.
power users.
Well, that-
They use all that
Well,
data.
I understand, but why would you be charged in this department to upgrade computers in the other departments? Just because they use GIS?
Because they're connected to GIS and they
That's
manage
right.
it. We had this GIS team, and this area controls all that and deals with it. And the other thing is just trying to keep up with it, because
Correct.
if I place 2,500 here, you start, what we found in the past, we lost it.
That's how it
And we would say,
was.
where was it at? Did we charge it there? No, let's pull it together, and no, if you're gonna buy 10 computers, buy 10 computers. That's what you gotta do.
Yeah, usually you had departments all in different locations doing
And
their
stuff
own
didn't get
thing.
done. And I've already cut 10,000, because they were at 45, and I cut it to 35.
Well, I know, if you cut it
So
by
I've already
10,
got
I
it.
figured I'd cut 5, I mean, but
You can't always do that.
Well, if I can, Mr. Mayor.
I'm looking at the history here of the total budget, and when you look at it, the manager's recommendation is a reasonable budget as compared to previous years, and I believe we need to leave these items the way they are. at this point.
Mr. Daugherty?
Well, now what was this amended budget of $106,500 for this year? What was that?
I'm not aware of it.
We'd have to pull the detail, have you got that?
Please.
Pull the detail on it.
$106,500 this year.
I'm not sure.
Now we're putting,
You may go back and see what was in the
Yes,
original
ma'am.
budget.
Yeah.
Okay.
Well, while she's doing that, may I ask the question, Mr.
Mr. Cromartie?
If the budget was amended to reflect the dollar figure that was just mentioned, it came before us at one time or another, is that correct? And so that means that it was used or projected to be used, and just to follow up on what Mr. Mayo said, if you look across the history of the whole department, we can sort of be comfortable that within these budgets, unless it's glaring, the figures are consistent, because if you look at the bottom line, there's no great disparity, or there's maybe a climb, but I would encourage you to look, just as Mr. Mayo, I think, suggested, at what the total budget is, because as we go through these next 40 or 50, we're gonna have to rely somewhat on departments knowing how to move the money from one line item to another one, because everything is connected. I just heard, and I won't prolong this, as soon as she's ready, I'll stop, but I just heard that these departments, what you're looking at right here, are connected. It's like, where are those X number of computers setting? Well, you know, I'm gonna feel comfortable that they're put somewhere on somebody's desk, they're connected, and the dots connect, and they're being worked on and used by someone. So if we wanted to spare a little time, we could take the word that those computers are being used somewhere if they've been purchased.
Ms. Holt?
I need the breakdown of last year's budget, original budget. There was 50,000 in to update building planometrics. There's 10,000 development alliance internet application. There was 7,500 parcel mapping tools. There was 5,000 311 GIS. 10,000 updating map cut application. 25,000 additional data for CAD dispatch. 11,000 for board of elections intranet. That's it.
Mr. Daugherty?
well, I'm just concerned about the trend here. I mean, over here, we started out at $10,850. Then we went to a budget of $22,000. Then we had a budget amendment of $106,500, and now we're budgeting for next year $35,000. So you can see how this is really going up. I tell you, we just got through buying a whole lot of software and improvements for GIS from the $106,000, the budget amendment.
I'm not familiar with what
That
that
was,
budget.
they budgeted, but they didn't buy it.
But they didn't buy it.
It
They
wasn't
didn't-
purchased. Some of
So
that
you
was
all have not
purchased.
purchased it?
Some of that was not purchased. The building plan and metrics layer is held up based on a state project of getting aerial imagery back to us. That date went from this year till February of next year. So that's $50,000 we can't spend now until we get that aerial imagery. So we just put it off
Understand.
another year.
Is this income, the 106,000?
No, sir.
It was, you just laid out the different departments where it's going. Has any of those departments spent that money?
This was all budgeted in his department, GIS.
Has anyone spent any of that?
I think that's, was it 8,900 I said we just spent? Oh, no, it's
projects and letters?
33,500 with encumbrance.
33,500? That's from the budget amendment.
Are we going to carry that forward into next year?
Then we'll find out right now.
50.
Did they give you a date on it, Chip?
Projected February, I mean, I wouldn't carry it forward, we just budget for it again next fiscal
For
year.
the next fiscal
Okay,
year? See, I think that's part of why I was able to
There's
drop
been
it.
$8,000 on this line item spent, nothing encumbered.
Okay. Of the 106,500?
Yes, yes, sir.
Okay. It's on, here again, speaking to the commissioners, this is another item that is been amended for a need. And as you have said, that you're 3 years behind, and some of these are being pushed forward. And also, it was indicated too, where GIS departments or GIS is used in a lot of other departments. And as you remember going through these, sitting in on these departments, a lot of these departments were charging in their budget for GIS. And there are several departments that have GIS line items that are being charged. I wish they've been assigned.
That's probably a better, or more appropriate word. Yeah, because they are those power users or whatever, because they're attached.
Do you remember that?
I do. But here's my concern. GIS is used over there at the Board of Elections, correct?
Correct.
Well, the Board of Elections ought to buy their own computer in order to operate your software on it. It should be charged to your department.
Well, computers are budgeted through the IT department when it's a replacement.
Here is I understand, but here's a capital outlay on budgeted computers, you state, of $35,000, which
No,
was,
No, sir.
no, that's
Those are
only software?
This is
Yes, sir.
software.
Software and professional services.
Did I not just
related.
hear there were 10 computers that we needed to buy in order to have the computers to operate the software?
That's not CIP though. CIP items are individual items that are 5,000 or greater. A PC is only about 800 to 1,000. I don't know what the exact quotes were, but, and there's 30 computers, and they're budgeted 262.
What is 520?
520 is capital improvement plan. And
Is that software?
These computer
Yes.
systems, no, it's not necessarily software.
The amount.
It's just on capital improvement, it's items that are $5,000 individual cost or greater. Pam could probably add to this, but if the individual item is 5,000 or greater, or if it's part of an overall project, like virtualization, then it would go and fall under the capital improvement plan.
All right, we're going to talk around in circles here. Let me start back all over if I can.
I think I can do it in
Computer
detail.
replacements are
$10,000 is going to migration to 10.1 mapping software. $10,000 is going to permitting and inspections integration to GIS. $10,000 is going to the Development Alliance Internet application. Parcel mapping tools are $5,000. Mobile web application is $10,000. And they took out, when we reduced it $10,000, they took out the Development
We
Alliance.
took the WCD piece out, and that's why I said I could cover it under the 35.
So that's the breakdown on the
None of
35,000.
those are computers.
No, it's all software.
Okay, Mr. Chairman, I'm fine with that.
Okay. Any other comments? Questions?
Just one comment,
Mr. Pate?
and this may be answered during the IT part. Seems like it's a recurring theme that we're buying a lot of computers and software. Sounds like we have a lot of needs in that area. I guess that'll be answered when we get IT.
Well, yes.
It sure sounds like it.
He'll be addressing, oh yeah, and there are some of us just catching up. Yep.
Thank you.
Okay. Any other comments before we leave GIS? Just for clarity, 2 years ago it was 198,000, last year it was 114. and then it's 105 this year, and that is indicating that the salaries and so forth through professional services on the first half of the first sheet, page 21, they've been shifted to another department, is that correct?
Yes.
That indicates the largest part of the difference.
That's the biggest part.
Okay, got it. Any other comments before we move on? Can we do health now? Thank you. So we'll leave, the next one will be attorney, but we're going to stop right there and move to health. Mr. Smith, where's that one? 131?
Yes, this or?
Yes.
This for health.
Going to the health department.
131.
And Mr. Madden is here with any specific issues. Now, one thing within health, there are different segments within health, different areas like communicable disease, maternity, so there are different pieces to it. So really, I guess one of the things that we are attempting to do is to jump right into it, like on the you've got health administration. There were requests that I did not place in my recommendation due to just looking at trying to be conservative for the year. But I know Mr. Madden had some concerns, and so I don't know how you want to address it or where you want to start, really.
We'll start with, it is thick, rather thick. It's 190. It's probably 10, 30, that's 40. It's about 50 pages. So because of time, I'd ask Mr. Madden if he would specifically go to the numbers that you wish us to look at of your concern.
Well, my primary concern would be the removal from the,
Which number? Just fill out the numbers if you would.
this would be under, which number was that, Lee? Put that in there.
Which one are you talking about? Well, one thing we're looking at was on the dental, and I was trying to pull my.
5190,
I'm sorry?
So,
Is it 5191?
93,
193?
5191.
193, yeah, here it is.
Okay.
Yeah, okay.
Well, I had originally pulled out the 250,000 on mobile dental, and one of the things that we feel like we could do is actually do a change in some grants, add the dental back in there at a lower cost, get that back in, and make that adjustment, and then grant adjustments next year within 5193, and think we could make that work. It would not affect the bottom line.
I'm sorry. I feel like we're not on the same page here with that, so if we could go specifically to page 247 and pull out the total where it says 5193.540 has vehicles, capital outlay vehicles, and you see the final department has asked for $250,000 and the manager is recommending zero. Is that what we're talking about?
Yes.
Okay, thank you. Now, are we all there? Okay. Okay, go ahead.
Okay, yeah, my concern was because we had originally requested to increase the budget by that amount for the purchase of a mobile dental unit, and that was removed based on the county manager's recommendation. I've spoken with the county manager about that, and as he said about being able to adjust for some grants in next year, I think we have a resolution on that, and I'm okay with that process, but I just want to make the board aware of that adjustment so that we don't move past that and lose that opportunity.
Mr. Chairman,
Mr. Daughtery.
Mr. County Manager, what amount are we substituting in here versus zero?
Well, we looked at, I think we looked at a lower amount for the unit itself at a cost of
right now, the cost that's been asked is $125,000. The adjustment to that would be if we would like to enhance the X-ray machine, which would be a Panorex machine at about $30,000 to $40,000. But that's what we're looking at right now, the total cost of that unit. So approximately the highest amount, $165,000. Then we would have to probably paint the unit and probably replace the tire. So we figured maybe another $5,000. So a total of $170,000.
So you asked for 170 on that versus 250.
Yes,
Is that correct, Mr. Smith?
correct.
And this is a used unit, is that correct?
That's correct.
Previously.
This is a used Lifeline unit, new. These units right now would run about $450,000 to $460,000. It's a top-of-the-line unit as far as name brand.
With three.
It has 3 operatories on it. It's a 50-foot trailer, tractor trailer. It's not a motor home or anything like that. It would be pulled by a semi-truck. It's a 50-foot tractor trailer.
And, Mr. Chairman,
Mr. Kamari?
and what would the $250,000 purchase? What would it have purchased if it?
That's what we were initially projecting for the purchase of the dental unit, along with what I said, the adjustments, the X-ray machine and repainting and tires. We had not got an exact figure back from the where we're purchasing.
But then you're going to be comfortable with the vehicle that you're getting with all the upgrades at 170 versus 250?
Yes, sir.
Yeah, they were able to, because originally when we did the budget back in March, we were looking at having to go with something that was a higher cost, but then they were able to run across this deal, basically, and were able to reduce it. So I think between changing some grant issues, that I think we'll be able to pull this off at the 170, and there'll basically be a zero impact. And then there'll be some adjustments next year based on some grants, a revenue and expenditure. Once we anticipate those, we'll do that next year, but it would basically be a zero hit.
Mr. Fay?
As I recall, just some conversations with you that, I don't know, you've been black, service kids are not getting service. We're not getting any dental care, but the reimbursement from Medicaid might bring us in some positive dollars, is that correct?
Yeah, I've recently done a cost analysis on this unit, and based on the number of kids that were eligible for Medicaid at the 2011 is the most recent report off the Medicaid site. And based on that, a conservative figure was if we saw 3,000 kids, we have a little over 9,000 kids in grades K through 5 here in Wayne County. So based on some adjustments for the number of those that would be eligible for Medicaid and so on, if we saw 3,000 kids at the minimum of just the prophylaxis and the screenings and cleanings, the unit would probably, based on my cost analysis, be about $20,000 in the profit on the first year. And like I said, that is a conservative figure on my part. I calculated our bare minimum
In less than
operation.
10 years, we'll pay for the unit.
5, yeah.
Yeah, I think it will happen, I think, less than,
And provide that care that's missing.
But we'd rather say, best case is this, worst case is this. I think his 20,000 is a much safer figure. We think it's going to be higher.
Yeah, looking at some other models of departments that are doing this, health departments in other counties, looking at their revenue projections over the past 3 years, some of those have profited pretty consistently in about 80 to 100,000 in revenues above the board on these type of unit. And it really gets into meeting with the schools and working out the agreement for use to seeing the school children. So, but it looks positive.
I think it's a good move.
The need is definitely there.
Mr. Mayor, what was, when you were looking at the studies of the other counties, what was their projections? How many years did it take them to get into profit? Is that information available?
Yeah, I can get the board some revenue numbers for another county that has a very similar demographics that we do in their model. But their first year, I think they made a little over, I think it was right at 100,000. So they based on some of the numbers I looked at, they were talking about turning about $8,000 a week in services. And my projections were more conservative because, again, this will be a new process for us and getting parents to sign the consent forms to allow us to see the children at the school. But I think my projection was at like $6,700 a week. And that was before I saw their numbers. That was my calculated cost analysis on that.
Well, you and I have had this conversation about your return on investment and your profits is based on your dentists and your staff seeing the maximum number of students per day, and that's where it's all gonna be formulated, is a good staff that will get out there and rather than seeing 10 students a day casually, see 20 or 30. I know of one county that I'm familiar with that in a lot of cases, they were seeing up to 40 students a day. And that's hustling. But at the same time, this county also showed a profit much sooner because of that.
Well, my cost analysis showed us seeing at 17 students a day.
Yeah.
And that was based on those conservative numbers. And with our staff load out, which would consist of four staff at the max, 3 at the min, the dentist and the assistants and office person, we're looking at 17 to 22 being probably what our target number will be based on the number of students we have available.
Mm-hmm. Okay, thank you, Mr. Chairman.
Mr. Aycock. All right, I'm gonna muddy the water. You mentioned tractor and trailer. Have you worked in any, you got your certifications, you just can't go pick up John Doe and put in driving a tractor. The liability to the county, certification, CDLs, all of that. I mean, you looking at a, yes, certainly.
Yeah, I mean, we have those that with the county that I looked at as hopefully using, but there's a contract, a potential too, that we could maybe move the unit once. Normally, if we set up at a school, we'd have to move it maybe every 30 days to 1.5 months, and if we do maybe $350 to $400 to move it on a contract with somebody.
You can do either internal, like you've got drivers in one of the enterprises that actually can go move it. So there's a way to work that.
Okay.
We have a couple options, and I honestly, I haven't finished crunching those numbers because we did have those options available, and I looked at both of the, if the county can do it, that means it's going to save us more money, but if not, maybe $4,000, $5,000 a year total to move it from the sites. We have 14 elementary
Because
schools.
we just will not be moving enough to constitute the need for even a full part-time person. I mean, it's just so, so I think we do it internally.
My main concern is compliance.
Absolutely.
That's
We'll be
right.
compliant, we won't move unless we're on, absolutely. Good point.
Thank you.
Mr. Chairman.
Mr. Daugherty.
This may help and may not, but the health board this year asked finance and Mr. Madden to go back in and actually find a way to reduce that budget. And they were able to go in and actually find ways to reduce their budget. I don't remember the overall savings, but I want to say it was somewhere around a 4% savings budget cut from this current year to next year. And furthermore, a lot of these programs and most of these charges that you're going to find in here are mandated programs that we really don't have a lot of control over. So to find a way to go in and reduce the overall budget on all departments at the health department by approximately 4%, I think was a feat in itself, and I appreciate their job. The only question I had was the rental on environmental health. Why would we be, I think it was real property rental. Let me find that item. That would be 131, that's on page 238. 131-5180.410, rental of real property, and it's $3,600 across the board that is budgeted. Do you know what that $3,600 would be for?
I do know what that one is.
Pam, could you help us with that?
That's what it is. It's the First Citizens parking lot.
Okay.
Okay.
Oh, yeah.
We actually do not have official parking, and when we moved to the Jeffries building, we actually obligated that back portion, which really helps us instead of rolling the parking lot, we actually rent that parking lot from First Citizens to give us parking overnight and during the week, and that's what we pay.
And why would that be in the health department budget?
Because it was predominantly for environmental health to be able to put their cars in the otherwise over near Toreros, and it just gets
Okay,
jam-packed.
so environmental
Consistently,
health vehicles are generally.
That's right.
The parking lot is that, if you come off the entrance.
Yeah.
Right by
You'll
the
see it.
building, You'll see those cars parked there every night.
Okay.
Okay. Thank you, Mr. Chairman.
Any other comments, questions on health? Any other questions from the commissioners from health? I've got a few. On the salary and wages under Public Health Administration. Just be 190. It's 121. Under public health. As you know, and it's broken down into several departments, health is. This is under administration. We went from 540 in 2010 to 537, 11, 12, and it's up to 620. It's about almost $100,000 increase. Where is that increase?
With this administrative budget here, I believe that part of that has been with increase. There was an increase in salary on one staff, I know. I'm not sure about the,
I'll have to go back to the original budget.
When you say increase in salary, are you talking about raises for employees?
I believe there was a reclassification.
Reclassification is what I'm thinking.
Is what I'm thinking it was.
Is that $100,000 difference?
No, sir.
I hope not.
I think that's part of it.
How much of a part of it? Through February, you're at 416,000 through February. Ms. Holt, what is it up to now?
I just changed screen.
I'm sorry. Oh, I apologize.
Yeah, and I apologize for not having my budget officer here today to help be quicker on this and the clarifications. He's been tied up back at the office today with some months in work.
Hard is the health director.
Welcome to my world.
So you got the $100,000.
Not
No.
not quite. That's what I was going to say it was part of me, but I didn't want to throw that out there until I was certain.
A little bit upset, but it's not that much.
No, I think
the
that-
health director. Possibly, there were, I'm telling you, there were reclasses from last year to this year.
Yeah, I have
That impact.
I have this justification sheet here, but it doesn't actually have on the
You have
budgetary
to go
notes.
back from the last year.
It doesn't
But
have
I'm
it.
just trying to do recall on last year to this year, that there were some reclasses in there. Merits and reclasses that actually push that up.
That's what I'm thinking.
Ah.
It was actually driving those numbers up.
Well, it's a considerable, well, I'll just move on. It's a considerable change, and I know that we did hire a health director because of the death of our previous health director. So for me, but $100,000, I think represents enough to, ask questions about where those funds are. Of course, as we see these other departments, you'll see professional service, contract work. You've seen, commissioners have seen in your reports over the last 4 months, dental care, hourly wages, dental service. So when you're looking at.
Not me.
Okay, when you're looking at those, so $100,000 there, it'd be nice to know where that is.
I'll be happy to, if we can't get it, because you haven't seen anything specific, I'll be happy to go back and get with the budget officer and have a
We can
detailed
look at it. We can
Okay.
have details
description.
on it. We just got to pull those detail sheets.
Well, here again, I mean, you go from when you're in salary and wages, it's important to understand that you have gone from your salary and wages, your extra help, you went from 5,600 to 11,002, and you're at 12,000 this year for extra help. And then you have your longevity pay that went from 6,100 to 8,900 in 2 years. And you've gone on your Social Security, retirement contributions. These are increased considerably because of, in particular, hospitalization insurance contributions from 86,000 to 115,000. So when you add $100,000, to me, it's just not 100,000. When you add those thousands of dollars of differences in the benefits, it just sort of just jumps out and screams at you. The professional services 2 years ago, you were at 5,900. It went to 4,600 last year, and this year you're asking for $54,400 in professional services. Where does that $54,000 go?
Okay, now that one I can explain.
Okay, good.
That is CureMD. That is for the electronic health records software that we had talked about earlier this year, and had got a budget amendment when we were trying to get the sign a contract with them. And that's a system where by 2014, the Medicaid and the government is expecting healthcare providers to have electronic health records, and that was part of our process to get on board of that. And that was at the time we had been quoted $54,000 for the initial startup.
Okay. Medical, where does that money go from the 39,000 last year to 40,000? So where does the professional services medical, where does that go?
And it went from
That's 193.
131 is
131, 193 professional services.
We spent 36,500 so far this year.
Where did it go? What vendor, what contract? Who was the professional service provider?
That is, I believe, is part of what we do with,
One of your doctors.
that, yeah, I believe this right here is what we're paying out.
Wilkins?
That's what I was going to say. It's either Wilkins, or maternity health. I was going to say it's Charlie, which are pharmacists. And Dr. Wilkins, who does some of our maternity care.
This is Charles.
This is Charlie? Okay.
This is now, you moved from maternity now, but there's another department from maternity, so this is administration.
This is pharmacy.
This is pharmacy. That's why I said we've got two Dr. Wilkins that work with the health department on contract. And this right here is for the pharmacist. We have to have a licensed pharmacist to oversee our dispensing of medications out of our pharmacy.
Okay.
And this is for him.
All right. I would like to go to the
Excuse me,
minority.
could I go back to that one?
Sure.
On the pharmacy.
Mr. Donner.
So you could not put that into one of these other categories to, as far as the pharmacy? You would have to put that under administration, as far as the extra help?
Well, yeah, because we don't really have a pharmacy program a budget for the pharmacy
The
program.
admin's kind of an umbrella. And I think Ken Stern has talked about that before when we looked at why here. Some of it is an umbrella, and that's the most appropriate place to put it because it's not just maternity, it's not just, that's the umbrella.
It covers all because we dispense medications out of our pharmacy for multiple programs, and so putting it in one program would not be completely accurate.
Yeah, I'm only concerned about being able to pull down monies from the state or the federal,
Well, they still
whatever,
can
to
do that
offset
if
that,
they
and
do
they
that.
will allow you to do it even though you have it
Yeah.
in this
Yes, that's correct.
category.
If he uses his services elsewhere, we can use that to draw down
They
those
can code
monies.
it.
Okay, thank you, Mr. Chairman.
Any other questions before we leave that, administration? The next one on the minority health program. The minority health program will be 194, page 194, it's 190. For minority health program, We have 66,000 2 years ago. Last year it was 102,000. So far this year is 65,000, and you've asked for 83,000 this year. Who is that professional service? Who's that provider?
This is,
190 or something?
this is a subcontract. Yeah, that's with Watch. In this particular year's, when we applied for the Minority Health Grant and we received a grant, one of our deliverables in that grant was to pay for a nurse practitioner for Watch Mobile to be able to see patients that served in our churches in this Minority Health Grant, and they would actually have enough capacity to see those patients, because at the time, Watch did not have enough providers to cover. Yeah, this is grant funded.
That's 100% grant.
Yeah, that's correct, 100% grant funded. This is a grant for that, and the grant funds that nurse practitioner. And we also contract a small amount with Cooperative Extension to provide some teaching and education with our churches as we do our kind of Train the Trainer, Faithful Families initiative.
Okay. I wanted to bring that out because the commissioners have received outside agencies that we fund with county dollars. Watch is one of those at $220,000. Just wanted to make you aware of that as we move forward through this day.
Mr. Chairman.
Sir? Yes, sir, Mr. Donnery.
I want to make sure I'm understanding here. This total budget of 167,603, their total budget there.
Which page are you on?
I'm sorry, that would be on page 195, showing that the total budget would be 167,603. Is that entirely from grant funds?
That's correct.
Minority Health.
And as such, in giving you that grant, they required you, as a condition, that you had to provide the nurse practitioner or whatever for Watch. Am I correct?
No, sir. We're not required to do it as part of the grant. Part of the grant is we explain to them what our initiative is and deliverables to try to reduce disparities in the minority population. And one of that was we saw that access to care and having a medical home was not available for certain people. So what we did was opt to allow the people that didn't have a medical home, a place that they could get routine care and continuity of care, to be able to go to the Watch because they were uninsured, which is what the Watch premise is. So we funded the nurse practitioner to basically support our initiative, which was to create wellness coordinators at churches to monitor blood pressure, weight, diabetes issues, and then make sure that if the person had those conditions, they still without a provider to go to and not having to show up at the ED, so they could go to the Watch unit, and we cover nurse practitioners to take on that capacity.
No county funds here.
That's correct.
All grant.
That's correct.
Thank you. Thank you, Mr. Chairman.
Thank you. Any other comments? Move on to the page 200, to school nursing funding initiative, school nursing. Again, health department for under schools. 2 years ago, there was not anything. Last year was $249,000. The budgeted, of course, was $250,000. It's been $250,000 this past year. We're up to $250,000, and you're asking for $250,000. Just for clarity, explain that program, please.
Okay, that's called the SNFI grant, and it's SNFI, means School Nurse Funding Initiative. What that allows us to do is improve the ratio of nurses to children in schools. So we're funded at 5 positions at $50,000 each to put nurses in the school system. So that's 5 times $50,000, which is $250,000. That's 100% grant funded.
Thank you. Any comments or questions on Mr. Acock?
Does the hospital play any role at all in that? Do they provide the nurses what?
They don't provide any, I believe, directly to the school, but they do provide nurse practitioners for the WISH centers, which operate in some of the schools. So in WISH center and the school nurses are different. The WISH center is more like a little, okay. And so, but no, to answer your question, not that I'm aware of.
Follow up. Mr. Tate.
You got 5 positions. How many nurses are out in the school system altogether, you know? I mean, are they one, is there one at every
I just
school?
looked at those
or-
numbers the other day, but I won't be able to recall them right now, but I'm not 100% sure how many in total.
I don't know if we had them all covered or whether some of them rotate around.
I think we're actually down some based on our
Yeah, 'cause
ratio.
We're not 100% covered in schools.
That's correct.
I'm certain of that, we're not 100%.
And we're not 100%, he's correct. I'm not sure exactly what the
They
ratio is.
actually have to move from multiple schools. I know, for instance, with the WIC centers, they have some PAs, a nurse practitioner that actually go from, you've seen some of gosh, Dr. Taylor, they actually move some of those MPs or PAs to several schools. There's no one. They may be there a few hours today in the school.
But they do
couple hours
move
tomorrow.
around.
They move around.
What's right here is RNs.
Yeah.
And he's right, they do have to move. Some of the schools don't have an RN that can be
5 days a week.
be at the school 5 days a week, 8 hours a day, so they end up having to move partial days to certain other schools to cover.
It's almost like having a mini clinic.
Mr. Aycock?
They just covered what I was gonna bring up. They do, they wrote, you know,
They rotate them.
right. I
So
mean, I
except
know,
in the place where you have a wish center full-time,
Right, right.
the rest, they move them around
they do move them around.
in the, what
Correct.
they call critical areas.
Thank you. Any other questions before we move on off that subject? I just thought it was interesting to bring that up to explain it to you. Tuberculosis project. Page 207. I was just looking at the amount, and we can get into the weeds, I guess, we have a total, 2 years ago, in 10 and 11, you had a total in this project, I'm sorry, it's in communicable disease, I apologize.
51.
Yes, sir. The total is 205,000, 2 years ago, 214,000. Thus far, this year, we spent 147,000, but you're asking for 352,000. Considerable increase. Could you expound on that, please?
Well, one is that was we were able to fill a position that we had in, I guess, a holding pattern based on, as Mr. Lee was explaining earlier, you know, sometimes if the need is not immediately right there and we can hold a position off to try to cut some spending, then we can do that. But in this case, as you can see, communicable disease has grown. The need for services has grown. Matter of fact, it's our second largest clinic in the health department at this point in time. And so we needed that other position to be able to cover our number, and that's the growth.
You added the salaries, it was 133,000 2 years ago, 134,000 last year, and you've pushed it up to 229,000. And you're now contributing that increase to higher communicable diseases. Can you get more specific, please? Why you need this? Why is it on the rise? And is there something that we really need to pay attention to and probably include it more to reduce the percentage of whatever the issues are? I mean, this is a considerable increase.
Yeah, and like I said, this is increased, it's pretty much the burden of the county. I mean, the bulk of this is county appropriations.
Right, not grants.
That's correct. We get approximately, I believe, about $8,500 from the state for communicable disease. We get a very small amount in fees, about $1,000, because again, most of this is at no cost to the client. It is not free, but it's at no cost to the client. So the county picks up approximately about, let's see if I'm reading right here, about $200,000 on that. And that is growing because the rates of chlamydia, gonorrhea, and several other communicable disease have, constantly stay higher than what we'd like them to be. And we're treating more patients, and that's required us to have another nursing staff. We also, I believe, had a TB nurse that we weren't really utilizing the need in the TB program, so we moved part of that over to the communicable disease side, where the actual workload was being carried out. As Mr. Daugherty said earlier, we report, if I have a nurse, she may work in 3 programs, she may work in maternity, communicable disease, and TB, for example. And every time she works in any of those programs, she records how much time she puts in there, and that's how we end up calculating our budget for our needs. So that's how that's grown.
The bioterrorism program. And I just have just a couple more for you, Mr. Madden.
Certainly, take all the time you want to.
No, it's,
I'm here at your pleasure.
but we have professional services. 2 years ago, we were at 26,000, and then there's not been anything under bioterrorism program for professional services. I did look at the bottom line, but you did go from 45,000 to 65,000. So far this year, you've only used $12,600. And with 4 months to go, I was trying to find the 12,006 going up to 65,000.
Hopefully I can justify that for you.
Okay.
Bioterrorism has been a kind of a moving target since I've been here for a year. We get a large portion of this from the state. Approximately $40,000 of that comes in from the state. And originally, the county was actually contracting with a person to do preparedness, and mainly they were paying them on a contract rate to do our plans. When I got here, I saw the need to actually have a person to do this, because these plans, when we got what they call our TAR, it means our technical assistance rating result, we were actually much lower than other counties from the health department standpoint on our score rating. And so I saw the only way that what I was seeing with the counties that were having the higher scores, they actually had a person in place. So I asked to hire that position. That was allowed. We hired a person in. The reason why our expenditures are not as much as they are, because that person worked for several months and then resigned and took a job elsewhere, of course, making more money. The good side of that is, if you'll see in here in our budget projection, I have actually worked out a contract with another county where if we can we got interviews tomorrow for this position, hire a new person on, 26,000 of that position will be funded by the health department. I'm sorry, it will be 35,000 will be funded by the health department, which is pretty much what our grant money is, and 26,000 of that will be funded by the other county as a contract. So that's actually been a bonus there, because we're bringing in $26,000 to contract that person out.
Can we reduce to 65,000? Can we reduce that down? Can we take about 15 or 20,000 out of that?
Not in hire a person in the position. We would have to go back to only a contract basis, because in order to have the person, we get the 40,000. The bulk of that goes to their salary. That additional amount is pretty much operating costs for that.
But I thought I'm sorry, I apologize, but I thought you had that in 121, because 2 years ago there was zero, but you had 26,000 in for professional services. That's on 190. And then you brought in, and you dropped that in 190, and you were at 4,200. Then you had a budget amendment of 26,000 in 2011-12. So you've indicated that you want 30,590 on 121. I was asking, and then of course you've come down to professional services with a zero on 190. This is all on page 208. So if you're pulling it up and adding on the top for salaries and wages, you reduce the 10 or 11 budget of 26,000. You don't have anything this year, and to come over and ask for, that it was throwing me off.
Okay, yeah, and what I got here, and we actually completely took out the professional services request in this current budget year, removed that 10,000 by 10,000, which was a zero.
Right.
And like I said, the reason why that was because we were originally contracting with a person. They were not a county employee. My plan was to have a person as a county employee and then contract out 0.5 FTEs or half-time of their position with another county for $26,000, which I do have a contract for that. Does that?
Yes, I got it. I'm
Okay.
clear on it.
It's a little confusing, and bioterrorism has been a thing where the money has went up and down over the last few years.
Okay.
So each year, we kind of backpedal a little bit and go, okay, what are they going to fund? And then once they figure out funding, if we hire a person at X dollars, and then and we base it on what the state's giving us for the BT, public health preparedness money, and then next year they cut us 8% kind of last minute, then we have to make up that difference and figure out what we're going to do. And hopefully in this shuffle, by contracting out with another county, we should mostly let this be state and contract funded and not really require any dollars from the county.
Got it. Two more departments. One, Child Services, on page 216.
Child services.
Yes, sir.
What number is that?
That would be 121.
Child health.
Page 216,
5161.
5161.121. You, again, it's the salaries and child services, up to 230 from a budget of 215, but it was, 2 years ago, it was 183, year before it was 169. Thus far, it's 122. Ms. Holt, I don't know where we are through now on year-to-date on salary and wages.
This is 5161?
It's,
Okay.
it's 5161, 121.
Okay, thank you.
And along with that increase, you had professional services where you were not budgeted over the last 2 years for professional services, and you brought it in this year at 18,409. And that would be on 190.
There's a lot of vacant positions in this department.
Do we have to budget for vacant positions, something that we broached about 3 hours ago in departments? Is this one particular department that there are vacancies in line items that you've budgeted for but yet do not intend to fill?
Most of this money right here is actually pulled down from the state. And what we do in this case here is we had two, I think, one position that was vacant. I'm trying to recall, we got so many programs. One position I think that was vacant and one that's partial. And we had a supervisor that left, and we had slight salary lapse there. But in this case, I think what we're operating at is based on it's kind of complicated to explain, but so I'll try to explain it without making it too long. We get a per member per month payment for that. You familiar with that?
Very much.
So in this case, we get X amount of dollars to these clients. Well, currently, we were not seeing as many clients as we needed to meet our per member per month. So we've changed our referral process on that and how our staff is responding to those referral processes. So we should actually see a higher utilization of those services. So I think at the current rate, I wouldn't recommend making an adjustment to that. Now, next year, I would say we can revisit that if we haven't changed that. Next year, it would be a consideration to find out actually why. But now that we're just tweaking, and plus the state CMIS database has given us new reports, it's allowing us to understand better who we're not seeing and why.
All right. And the professional services to 18,004, who's the provider there?
This is, this right here is, when we do work with our community partners, it's a projected, how much have we used so far, Pam? Can you tell me, please? This is where we work with community partners in various avenues because CC4C is a community care for children, and it works with children with recognized with developmental delay issues. It could be anything from hearing, vision.
Who is it?
It's, I don't know if I'm trying to think of who we've used this year.
Year to date, there's not
Anything for
any.
this year?
Yeah, we haven't used anybody, and that was one of the things where if we anticipate, we use it was an anticipation amount for that.
That's what I just noted, it was anticipated use.
That's correct.
Based on the contract.
So that is something that we could make adjustments on, as long as we don't want to cut the money below what our per member per month is, because we still have, because otherwise we're not using the money that we're being given from the state to serve the clients.
And if we're not able to do it with contract, so you can get that service done.
So I can go back and look at that particular line item and see if that actually needs to be restructured.
We don't want you to do anything that's going to jeopardize receiving money or being able to have to send it back if you don't use it. But if this is something that you've created in order to enhance the program, to enhance the state to give you the money, be careful there. We all understand that.
Yes, sir.
But to get your per member per month. But just, you know, when you've got zeros from 2 years ago to last year, and you've not used anything to date, of course, I would like to know what the 18,000 was put in there for.
Yes, sir.
And who it goes to.
Yeah, I concur with
It's
you.
new, so.
And I can go back and look at that one to see if we had plans that I'm not recalling for utilization of that fund.
If you'd make note of that, I would appreciate that.
Yes, sir. Has been done.
And that is, the last one I have is the WIC program. That would, that's women, infant, and children, is that correct?
Yes, sir.
Which is that 100% grants? What part of,
WIC?
there's some of that, this county, or do we take it all?
The majority of that is federal money, but the county does put in, right now, approximately,
Pardon, Mr. Chairman, what page is that?
about
I'm sorry, that was page 231.
$12,000.
The county puts in
Does that
12,000.
sound right? That's what I got right here on mine, about
That's on
12.
page 231.
We draw down close to $1 million of federal money to provide that program. It's primarily federal dollars. The reason why county dollars goes in is there are a couple of requirements, needs in that program that the WIC money, they have a very stringent guidance on how we can utilize dollars, and some things they won't cover. Sometimes it has to do with, for example, not in our case, but it's like it could be rent space, they'll cover it, but you got a real complicated formula, so certain things we just pay for out of the county dollars to avoid having to go through all these formulas and then having the audit, create a problem with us.
Well, my main concern was to see how much of the county was sustaining the program, tax dollars of the county. Here again, it's the pass-through working a gross in reference to a net that we've been speaking of this year. And when you see the salaries going up from 430 to 483, and then you've got it at 571 this year, it's nearly $100,000 in a salary increase in 1 year. And then when you look at the bottom line, which is 2 pages after that, at page 233, when you go from 682,000 to 753,000 last year, and you go to 905,000 this year, which is the manager's interpretation of your department brought in 866,000, and the county manager is asking for 905. So you can see the protocol or the sequence of events that I've just talked about to get sort of an overview of what the county is paying, what the state is paying, and do you see something relevant to what the manager is not seeing, or you manager seeing and you're not seeing, why the difference in what he's asking for, what you're asking for. This is, close to $40,000.
Some of that, if you look at page 233, Janice, I think once we got the manager's column, we talked to Ken Stern, and there were some items in there. I had made a note, and I think you quoted 12,000. I was saying worst case, on our side, the county would pick up 15,000 of this total 905. No, we invest 15, we get, right at 890,000 or whatever. So
If you invest
15,000 is our share.
If you invest 15, if the county invests 15,000, and you said we're going to pick up 800,000?
890,000 after we invest 15,000.
That's what we draw down through the federal government to provide this
That's
supplemental
correct.
program.
And
That's a great return on your investment. Mr. Cromartie, Mr. Cromartie had a comment.
That's 800 and what?
890,000 that we receive. When we invest 15, we get 890,
And one thing to note too is
plus or
that
minus $200-300.
these WIC vouchers go to our local stores, which enhances the community too. All this money that comes through goes into our local stores as well for
No, it doesn't.
the
Sales
clients.
tax revenue.
Yeah,
Sorry?
Sales tax revenue.
Correct.
yes.
And also, if I'm not mistaken, one of these salary hikes you were talking about is we got a one-year position in there that's going to be funded by the state for this. We're actually, I think we're a pilot program for the new WIC software called Crossroads, because the current software is very dated. And so we're the only county that's been piloted, and part of that was because of our location, but also because of our such high return on our clients, because they only ask you to get 97% of your client served. We get over 100% almost every month, every reporting period, so they do a phenomenal job. The staff is fantastic. And so that's allowed the state to actually fund us a nutritionist for 1 year. After 1 year, we will not absorb that position. The county will not take it on, but for 1 year, they'll pay for us to have another nutritionist down there to help us implement this program for the clients.
Okay, thank you.
And just one,
Mr. Cromartie.
for public consumption, WIC stands for what?
Women, infant, and children. It's a supplementary.
Women, infants, and children.
Yes, sir. It's a supplementary nutrition program. It also promotes key things like breastfeeding and so on with parents.
And this looks like a good thing the federal government is doing.
I think so. It's a very good program.
Thank you.
Any other comments on the WIC program? Mr. Aycock?
Yes, I probably know just enough about it to be dangerous, but by having family members in the medical field, several of them, and also personally knowing some people that use this program, this is one program that I've heard more positive comments on than anything else involved with dealing with health in the county. It's I've really heard good comments on it. Thank you.
Thank you, Mr. Aycock. Any other comments on the WIC? I do have one question. Is there enough room where we have right now crossing the office building, the county office building? We have a WIC, we have a building there.
Well,
Is
not
that,
really.
is that, what do we need to do there? Is there anywhere in the budget that you have wanting to put in this budget for a capital improvement plan for WIC?
I'm not really prepared to answer that. Not really. I mean, we have.
You got one board member.
We have one room. We have room over there to be able to currently do what we do, which is a lot. There's a lot of people that we see, but it's probably not enough space total for the clients because our waiting room, for example, is insufficient. But I think that's something that that we need to look at moving forward. But right now,
Okay.
I mean, they're getting by.
Okay. I would just maybe recommend, or suggest that you get with facilities and Mr. Smith and your board and approach the facilities committee to see if there's actually some way to sustain a larger building, because the facilities committee are looking at areas to do that.
One of the things, just to make note, we already in the 50,000 square foot that was recommended by Facilities Committee and will be under study this fall, is to look at 50,000 additional square feet at the COB, which would include WIC and actually get them out of that facility.
Okay, thank you.
Mr.
All right.
Mr.
But I
Chairman,
didn't want to interrupt.
Okay, no, thank
Yeah.
you. That's what I was just
Okay.
suggesting.
All right.
Mr. Cromartie.
I would suggest that you act expeditiously.
I'm gonna have to get y'all a thesaurus. I'm gonna get you guys a thesaurus.
We got to get us another word.
Just say quickly.
I will act expeditiously.
Any other comments on WIC? That's all I have for the the health department. Any other commissioners have any comments on? Thank you. Thank you for Mr. Madden for coming and. Any comments?
May I have an opportunity to cover two
Yes, you
things?
can.
Item number one is I understand that initially there was some concern from the board about our dentist payments, what we were paying for as in multiple dentists. You were seeing a contract amount, and I just want, you may have resolved that, and I'm not aware, but I wanted to bring that up for clarification. I heard it looked like we were employing multiple dentists, and the question is, why do we have money over in this pot, and why are we using money out of here to, and that, just wanted for clarification on that. That was pertaining to the fact that we do not have a dentist hired permanently at this time, and so what we've been doing is the salary in that line item has not been used, even though it's budgeted because we have to fill that position, but it's not being used. So what we were doing, we were contracting with DenTemps to cover, and we can't usually get one dentist to cover us continuously, so they'll rotate with 4 or 5 different dentists that we get through, and we just pay them at an hourly rate. And I just wanted to put that out there for clarification, because I had heard there was some concern on that, make sure that we weren't double dipping is effectively what I think was kind of how it was explained to me, so we're not doing that.
To elaborate on that, if I could, Mr. Chairman.
Mr. Dollar.
That's basically a temporary dentist that you're hiring and using at $100 an hour, is that correct?
Yeah, we hire them from 90 to 110, depending on, they set the rate with the temp company. And also, and I know I'll paint myself in a corner on this one, but, you know, every time you bring this up, you know, you look like you're self-serving, so I'll do that for the sake of my staff. You know, we did submit merit increases, so I would like the board just to consider those and look at that, because that is, you know, our greatest asset to this county. I mean, we serve people in everything we do, and, you know, it's our employees, and we've lost a couple at the health department recently to higher salaries. I think they deserve the reward, and I'll leave that to the board to make the ultimate decision, and I support you on that, but I just wanted to make you aware that we have submitted them, and please give that the due consideration.
Just for,
Just a question real quick. Was that submittal, is that included in your suggestion, in your recommendation?
Did not recommend it.
Okay, thank you. Mr. Cromartie?
well, that's what, and where would it have been recommended at? What line item? On what, would it have been on the administration or?
It would have actually been, for our department, it would have been across all these programs and the salaries.
It was kind of smattered and scattered about.
Yeah, it would go across the entire thing, depending on which programs any of the staff worked in, and for those that, because some of them work in individual programs and some work across multiple programs. So
But I think in most of those, Pam, we didn't enter the merits, did we? So they wouldn't show, because if I didn't recommend them, they don't even show.
There's some line items that have dollars by them, and we're going to need to ask.
Yeah, so we've got to find that out, because typically, they will not show unless my office recommends them.
The process for the budget is merit should not be entered, but I do see some dollars
Yeah.
on merit line items.
Yeah, I've made 2 notes that it looks like it might be there, and then I didn't recommend, so it might come out, so.
This is about the 3rd time we've heard from department heads. This concerns me. And it's about the 3rd or 4th time we've heard from department heads now that are implying that they are suggesting or recommending merit raises, cost of living adjustments, or whatever. And each time, Mr. Smith, you said that's not included. Now what I'm hearing that it possibly is included. Is
Well,
that true?
they may, when they enter the budget.
I'm just asking because she's responded differently.
Well, let me look at the detail on it. I can't speak for the health department side of the budget. It could be something else. It is on a merit line item. And we just looked at it. It could just be an error. Their explanation is staff time spent in program, and that doesn't go along with the title of the merit line item, so I think we need to consult with the health department and see what their intentions were.
Yeah, that would probably be salary costs put into other program, because we may have had, say, Nurse A budgeted in programs A and B, and she may have ended up having to work some in C and less in A, so that line item sees an increase in the salary, because that's where the money was drawn down and reported. It doesn't change the salary of the nurse. There's no change. She doesn't get any more money. It's just simply how we report the salary expenditure in one program versus the other.
Direct, indirect cost or?
Probably we need to change the line item number and title.
Exactly how it's titled, it should not be there.
But the understanding is that this budget does not in any way reflect merit increases.
Merit or reclass.
Is that what you're saying? Okay, thank you. Mr. Corman, do you have a comment?
Well, I would like to ask the director, you had some obvious justification for asking for merit raises for your employees, didn't you? Did you have some?
Yes, sir, that's part of the process, is we have to turn in a justification sheet, and for those, and it's something that I don't do individually for every person in the health department. The program managers evaluate their staff, and then I evaluate the program managers and so on, and that's who we turn in for recommended for merits. And I will say, if you allow me to, I understand that the health department's a big department, it's one of the bigger departments, and so, we do have a higher merit request because of that staff, and, if the board considers that, I'd be happy to even go back and, with my staff and reevaluate and prioritize, because I know what we're trying to do here is to be as fiscally responsible as we can, and I'm happy to do that, but I just wanted the board to give that consideration.
Thank you, Mr. Madden. Mr. Kumar?
I would just like to sort of say that, as I have expressed concerns about folk having opportunity to experience a raise or a merit raise working within any department, what I would be interested in knowing, since I'm new on the board, is what was the feeling of the previous boards towards merit raises, and what kind of a timeline were they put in, and is it because this is a new board, merit raises are not likely to be recommended or suggested by departments? You're looking at a person who worked themselves way up through the system in education, and therefore we came in at a rate, and based upon sort of a contractual prayer that we would get merit raises and so forth and so on. And I hear you say that you've written justification for these, but I would want to know if how were merit raises determined appropriate in the past, and if there's a trend on this board that they're just not going to be there. I think that's deserving as we walk down through all these departments, so there's no misunderstanding about what directors can expect and what employees can expect. So I want to first congratulate you that you have looked at the merit situation and have written your justifications and will advocate for what is just. And to take this one step forward, I find around the county and in reading the newspapers that there's a suggestion that we are losing employees, not just in one place in public working situations, but in other ones, because our wages are not matching the folk around us, therefore losing quality and experienced help. And that loses something in the quality of what we're going to produce in Wayne County.
Thank you, Mr. Cromartie. Any other comments, suggestions before we move from the health department? Mr. Madden, do you have anything else that you want to share with us?
No, I just appreciate your support, and thank
Yes,
you
sir.
for allowing me the time to get up here early so I can get
Thank you, Mr. Madden.
Thank you so much.
This time, before we move to the next item, we'll take a break for 30 minutes.